Actually, there will be a lot, but the three most or the top three priorities, if elected, would be for to look at the membership. So I'll prioritize membership, the climate change, so very important for our college, and as well as advocating for the continuing medical education of our physicians. So with regards to the membership, we would like to increase the number of diplomates we have by giving them uh, more things to do or to review and to increase their potential to be fellows of the college. With regards to the climate change, I would like to increase awareness also for the uh, decreasing the carbon prints that's each physicians we have, including in the different uh, accredited training institution. And then with regards to the advocating continuing medical educations, I would like to propose that we will also coordinate or collaborate with other big organizations internationally.
We've selected the top priority for PCP. First, we need to increase the engagement of our chapters, especially where they are doing their works. As we know, primarily our chapters are the one dealing with the grassroots level and where most of the projects are being held. Second, I think we have to strengthen our residency program. As of now, there are a lot of areas where we may need to have more residents to fill up doctors to finish internal medicine for the universal healthcare. Also, likewise, we need to probably look into the salary, especially of this training institution, where it has been always an issue for our trainees. That's probably why we are having some lack in the number of trainees. And lastly, we need to engage more and have more ethical principles to be inculcated among them, which may also start during the training, and then we need to have that continued after their training.
My top three priorities. Number one, I think it's very important that we together make sure that the membership of the Philippine College of Physicians are competent, conscientious, and compassionate doctors. I think that's the first one. We're like the source or the supplier of this important expertise that our country really needs. We're the best in internal medicine and in all the other related subspecialties. The next priority I will have to deal with would be the bridging, being that link, having programs that create opportunities for all the physicians, all the more than 14,000 physicians that we have now in PCP, to in the different chapters, in the different component societies, that we can link them and their services, their expertise to the Filipino people. And number three, the next priority I'd like to spend time on would really be to, again, because we are going to be the supplier of this expertise, to have special time and continue to improve our training programs for both residency and fellowship.
My top three priorities, if ever elected as a PCP leader, I am for evidence-based medical practice, patient-centered, and physician-friendly policies. By being an evidence-based medical practice, we should encourage our PCP members to do research and evidence-based medicine. For being patient-centered, we should encourage our policies or any other reforms to be able to give special attention to our patients, which is our priority, especially for the underserved areas in our country, by giving full and equal healthcare accessibility to all our patients. And for our physician-centered or physician-friendly policies, we should also prioritize the well-being or welfare of our internal medicine practitioners while giving them access to continuing medical education program, certifications and training, by also promoting digital hybrid platforms so we can reach the internal medicine practitioner in the remote or in the provinces to encourage them to continue learning not only on general internal medicine but also on the subspecialty modules. Thank you.
Siguro po kapag ako ay nai-re-elect sa PCP, ang gusto ko po sigurong gawin ay pagpatuloy yung mga programa na dati nang nasimula nitong nakaraang mga taon. No? I don't think we have to reinvent the wheel. There might be some undesirable things that are happening, but there are most of them are good ones actually. So every year naman po, no, sa 8 years ko na nasa board, ang ginagawa naman po namin ay nire-evaluate yung mga programa at hindi po tayo lumalayo dapat sa ating mission vision. But if you ask me personally kung ano po yung gusto kong gawin na priority, number 1 siguro po is to increase membership engagement. After all, when you talk about the Philippine College of Physicians, it is really an association of physicians. No? So yung mga doktor po, so ang priority po natin dito, number 1 would be our peers, ourselves. So dapat po lahat ng gagawin natin sa PCP ay for the benefit of the members. And then number 2 po would be patients. So diyan na rin po pumapasok yung ating mga kaalaman sa iba't ibang aspetong medical, yung training na kailangan natin gawin para ho masilbihan natin ng mabuti yung ating mga pasyente. And then number 3 would be in terms of public policy. Palagay ko napakarami na kasi mga fake news ngayon. So kailangan po maipakita natin that truly PCP is a world-class organization that can be trusted and should be the one that will really tell us about the standard of care of medical treatment, no, of a lot of diseases. Kagaya po nung pandemic, pag may tinatawag, PCP kaagad yung laging nasa isip. So we should really keep that and we should show our expertise to everyone.
My top 3 priorities for PCP are the following. My foremost priority is the welfare of our members, especially our PCP members and their immediate family members, because I believe that for them, if we are able to give them importance, they will be able to become participatory to our college in order for them to be active in the vision and mission of our college. My second, and to make them proud and say that I am PCP. My second priority, especially for the local chapters, is that will be in the near future, our PCP will be a go-to health organization for local executives and community leaders, especially during times of health crisis, where they want to ask us for advice regarding health issues. We have to remember that as PCP, we should be apolitical. And my third priority is that PCP will serve as a significant partner in the health policy making of the country, especially in our country and around also our Asian neighbors.
Training our young internists is foremost on my list. Continuation and strengthening of the training programs, the ones that we have, which are already excellent, because I believe that the internist is the doctor's doctor. And I want to harp on the excellent care that our young internists can give to our Filipino patients and the community. And these young internists will be the future leaders of the organization and the country as well. I would also like to continue collaborating with the both the private and government organizations as far as healthcare policies, the promotion, development, and implementation of these policies that will guide us in our delivery of excellent healthcare to our country, to the Filipino community, to our adult population. Because I know that collaborating with them will strengthen the mission and vision that the PCP is having for everyone in the country. And then, of course, Doctora, I want to promote research as well, not only to help us and guide us with the management of our patients, with the promoting the guidelines and the best practices that we can give to our adult population, but also to keep us updated with the new technologies, the new interventions, and to help find solutions to both the national and local problems as far as health is concerned in the country.
So my vision for PCP to establish a organization wherein it's empowered and then the members excel professionally and personally. So I foresee a PCP that is that exemplifies integrity, advocating for healthcare policy reforms, as well as to foster a culture of collaboration, unity, support, and excellence in healthcare.
As I've said, to be able to achieve the vision that I have envisioned for the Philippine College of Physicians, I will focus on 3 key priorities, which I have been consistent throughout my career. Number 1 is enhancing professional development and well-being through inclusivity and innovation to ensure that physicians stay abreast of the latest medical advancements, technologies, and best practices, ultimately leading to improved patient care outcomes. This can be done by providing continuous learning opportunities for its members through what we've been doing: conferences, workshops, online resources, and on-demand topics that can be viewed by members through our online platform or by leveraging on the learning management system that we have established before. I also want to be inclusive wherein I will help PCP in providing online review classes for members to help them pass the PSBIM, and leverage on the learning management system, or LMS, to train the trainers and trainees, and provide a resource corner for trainers where all the interesting cases and lectures can be curated and accessed by trainers to support the accredited training institutions. I would also like to continue to provide the forum where ethics and professionalism are part of the conversation for all members, including our trainees, and establish a wellness program, mental health, for our trainees. Number 2, I would like to advocate for quality healthcare by supporting policies and initiatives that promote equitable access to high-quality healthcare services for all Filipinos. So this includes championing healthcare reforms, addressing healthcare disparities, and advocating for the welfare of both patients and healthcare providers.
The PCP probably has established already the system to enhance the training program. Although I still feel that the chapters, especially on the provincial chapters, need to be more involved in leadership training and involvement in a lot of activities. Right now, except for, say, the environmental things, but situation seems to warrant that a lot of the changes coming from the national is quite, sometimes it's not that applicable to the local chapters. I would say the local chapters may need to path their own activities as long as it jibes with the national vision, the national vision. And I'm right now happy with the activity on environmental, our environmental activities. And I'm glad that our young leaders here in the chapter, in Panay, Western Visayas Panay chapter, is quite responding well to that. Also, of course, if you are from the province, sometimes you get lost in the business, and most of the time the leaders from Manila may not be able to communicate with us in a timely manner. So probably we can enhance that more to have more involvement on the local chapter.
As an organization, I still believe that the decision for vision and mission should be a shared decision of the key leaders in PCP. But if we given a chance to push for 3 priorities, this number 1 is push for impactful research agenda that includes NCD registry or the non-communicable disease registry, because knowing the burden matters before we can recommend healthcare policies to the government and intervention. Number 2 is community-based data. Since we have already relaunched the HERO, or the Health Education Reform Order, we should adopt community, teach them, screen the patients, empower the patients, and with that community-based data, we can leverage on healthcare policies also. And we can demonstrate to the government that prevention is key in decreasing healthcare costs and improving national productivity. And then another one is a platform of social media. We have to improve that, ramp up a platform of social media, because social media is now the tool for information of our patients and misinformation or fake news. Since we are the leader organization for healthcare issues, we should take charge of the narrative. We should be the one responsible for informing our patients through social media.
If I am re-elected as a regent of the Philippine College of Physicians, my 3 priorities would be: number 1, to ensure that PCP will continuously collaborate with international organizations in order to make PCP known all over the world as a world-class organization of internists. Number 2 priority would be to strengthen our relationship with the government, particularly with the Department of Health. I believe that policy making is a very important function of the Philippine College of Physicians, and that if we partner with the Department of Health and of course with other agencies in the government, we will be able to achieve a higher cause and a higher purpose by making sure that policies are made properly. And number 3, I would like also to strengthen our relationship with all other members all over the country. I believe that the PCP Central should be connected with our members in the different provinces and localities.
My top 3 agenda as a leader in PCP is, first, of course, to monitor the primary care competency that we have started with the RTP committee, so that the implementation will be, we will see the outcomes of molding a universal healthcare prepared general internist by the Philippine College of Physicians, as well as I want also to yung ating program of Balik PCP, to encourage all graduates of the PCP training program to take the exam, so that they will be inclusive. It would be inclusive as part of the specialist program of the Universal Healthcare Committee, and of course strengthening our social media and digital presence. Remember that we are in a digital world already, and patients and members should be aware and be updated of the use of also the digital platform for our objectives as PCP members.
Actually, doctors, my top priority, I have thought about this, would be encapsulated into my initials. My name actually, it's DESSI. So number 1 is about developing young doctors. So that's letter D. A PCP that realizes the importance of the young doctors as future movers of Philippine medicine and as our own future attending physicians, always providing inspiration, mental health support, and opportunities as they carve their paths as internists and clinicians, researchers, community leaders, medical content creators, if that is what they want, and whatever it is that their heart desires. Number 2 is for letter E. E means embracing diversity. I want or I envisioning a PCP that listens to and embraces diversity, including the gender and generation gaps from the great generation to generation alpha and the millennials that will follow realizing their differences and accepting their weaknesses and nurturing their strengths. And number 3 is S, so that's DES. S for superior standard, meaning a PCP that continuously promotes and strives for high quality medical care as we produce highly competent and compassionate ethical internists. Actually, if I may complete my acronym, I'd like to add 2 more. That's SI because my name is DESSI. S is for safeguarding because I want a PCP that protects the welfare of us as members. I want to protect the welfare of Filipino internist physicians currently or constantly checking on our current plight, our legal needs, for example, concerns, medical concerns, legal concerns, and finding ways, compromises, and other strategies to improve our status moving forward.
My top 3 priorities for PCP are advocacy, training, and research. Advocacy because I know that a lot of projects should be aligned to the government's advocacy and also to the Philippine College of Physicians. And a lot of diseases still need to be addressed. These diseases should be educated to the grassroots level so that the community will learn about it and will know how to address it when it comes. The second is service, and by training our residents, our new residents, we will be able to provide world-class service to our community. And the last is research. Of course, with research, we need to learn new developmental research. Developmental research. We will learn about new advances in technology.
When elected, my top 3 priorities as a leader are the following: advances of medical education and training, focusing on updating the curriculum to include the latest medical advancement and technologies, provide resources and support system for medical residents and fellows, including mentorship programs and mental health resources to ensure their well-being and professional growth. Number 2, strengthening healthcare policy and advocacy, like advocacy for universal healthcare, collaborate with the government agencies to promote policies that ensure equitable access to healthcare for all Filipinos. I will also focus on the public health initiatives that prioritize public health campaigns that addresses pressing health issues in the Philippines, such as infectious diseases and non-communicable diseases. My third priority will be fostering a culture of collaboration and innovation. Encourage collaboration among various healthcare professionals and organizations to improve patient outcomes and foster a holistic approach to healthcare. Embrace technology and innovation. Promote the integration of telemedicine, electronic health records, and other technological advances into practice, ensuring that members of PCP are equipped to meet the changing landscape of healthcare delivery.
I think it's more of, with top 3 priorities. I have been part of the training since I became a training officer of Mary Mediatics Medical Center for 10 years and training officer right now of the fellowship training program of Makati Medical Center in endocrinology. So training, and then second will be more of how can be of use with my additional knowledge on creating value care or value-based care system, knowing that we are now going into the looking more on the patient outcomes rather than just the goals of our treatment plan, being part of the clinical practice guidelines of several things like obesity, diabetes, and the thyroid, and the periodic health exam of outpatient. And then aside from that it's more also of collaboration with the government with regards to this UHC. I have been very interested on that because knowing that internists can be part of the primary care, I gone through training and more of talks with those of the creators of the UHC, learning more on how an internist can become as a primary care, aside from that, and how a specialist or subspecialist like an endocrinologist can also be part of the UHC system. So, of course, top 3, yun na po yung top 3, but of course, it's very close to my heart, the advocacy program and the environment, being exposed to the Philippine PCP Southern Luzon priority program on the advocacy on environment. We were there when it was created in terms of, especially with our mid-year convention in Palawan, we really highlighted on the environmental factors.
Thank you. In my mind and in my heart, I feel a deep responsibility to ensure that our work environment has government support as we support our patients. My vision is built on 3 priorities. First, strengthening welfare of physicians. Our doctors, from trainees to consultants, deserve fair wages and improved working conditions. So we should lobby and push and support stronger negotiations for higher salaries in the hospitals, medical schools, and the communities to have better benefits, and also security and fairer HMO reimbursements to ensure doctors are not undervalued, protected, or overworked. Secondly, enhancing residency training and mental health support, because residency should be transformative experience and not a breaking point, as several suicides have already been reported. And then lastly, advocating for systemic healthcare reforms. We should continue to push for full implementation of the universal healthcare and ensure that PhilHealth budget cuts are returned and thwarted to happen again. I support PCP stand on this, and we must continue with our active role in pushing policies that ensure transparency, sustainable funding, and improve patient care. By addressing these priorities, we'll uphold PCP's vision of setting the standards in internal medicine while ensuring our fellow physicians thrive in their respective professions.
Doc, since I am in the office already for the past 2 years, so I know that we've been working on several committees. I would just like to empower or improve such committees, and these are the following. Number 1, advocacy. The HERO program that we recently launched last year is, I think, one of the best tools that we can emphasize to address morbidity through preventive medicine. So I think we can improve on the HERO program and explore on other outcomes as to the HERO program. Number 2 is the UHC law. We should have a deep understanding, training, and several algorithms that can help both the old and the new internists in terms of understanding the new Philippine healthcare. And third, Doc, is, of course, membership. We have to produce more internists, and for the national distribution of these internists, pertaining to my vision, of course, Doc, for a full spectrum piloting service delivery networks across the country. So you see, among all these 3 priorities, this will lead to an interaction or collaboration with the LGU. So summing up,
even if you have all these three top priorities, if you don't have a collaboration with the LGU, then we can do so little. So hand in hand, Doc, we should help one another.
So my top 3 priorities for PCP if elected would be about healthcare system strengthening. So that will I will advocate for universal healthcare improvements, equitable access, and better physician welfare. Second would be about medical education and professional growth. So I would want to enhance the continuous learning of our physicians, make them engage more in research, and of course, ethical practice among physicians. The third would be about public health and policy engagement, where the PCP will lead initiatives on disease prevention, continue health promotion, and also active policy making in national health issues.